Hello and welcome to episode 10, our final episode in the series of podcasts on the National Cancer Plan. Through my conversations, the key theme seems to be a shift from fragmented, hospital-centric system to a faster, more personalised and more equitable cancer experience. For patients, the biggest early change should be shorter waits and more predictable pathways. Faster diagnosis and treatment are seen as critical to both patient experience and outcomes. Meeting waiting time standards was consistently described as the foundation of good care. Experience is a top-tier priority alongside survival and speed. The emphasis patients value is understanding what's happening to them, accessing clear information, having care closer to home, and being treated as individuals. For patients, this signals a shift from system-centred care to person-centred care. Tailoring treatment and support is essential to improving experience and reducing inequalities. The plan's success will depend on whether services can adapt to what matters to each patient, not just their clinical needs. Reducing inequalities is hardwired into the plan, not just improving averages, but closing the gaps for those patients for whom services are not as accessible as they should be. Technology and innovation are seen as enablers, not the goal. Using technology where it helps improve patient care, but not just because we can. The plan is ambitious. It's around implementation at a local level, looking at workforce pressures, capacity constraints, but still the need for system-wide coordination. For patients, improvements depend less on the policy itself and more on how effectively the local systems deliver it. I discuss reflections on the plan and the discussions that we've had through this series with Jane Winter, Director of Nursing at the Wessex Cancer Alliance.
Hello, Sally. Thank you so much for inviting me to come and talk today. And I found it so exciting to listen to the last 9 podcasts. I think having been involved in the cancer plan really from the beginning and the crafting of it as part of the clinical reference group, to actually hear the impact that it's having across all of our programmes of work, all of the clinical input that's happened from people, and the podcast, particularly Carla's podcast, to actually hear that it's landing in a way with people on the receiving end of care that matters, is vital. I think sometimes you can do something, can't you, in a place that designs something that actually doesn't translate into people on the receiving end of care feeling that and becoming a reality for patients. I think it's quite an ambitious plan, and it's going to require very strong clinical leadership to deliver that. And I think it's really reassuring to hear people like Laura talking, because you then have such a strong belief that they've got the skill and capability to deliver that. Whereas I think sometimes in the current climate, some of those voices aren't as powerful in the dialogue as they need to be. And I think as a nurse, obviously, I think a lot of that system transformation comes from nursing leadership, and our AHP colleagues. I think the workforce strategy is going to be really helpful in terms of really bringing the skill and capability of those clinical teams to life, and recognising and valuing them. And I think there's a real struggle at the moment for a lot of people on the ground, and I think so much of what we do really reinforces how much we value them, how much we really care about them, and how we really recognise their expertise and the contribution they make as a professional to that service transformation. And operationalising things like the cancer plan are a big part of that, and we need those people that are so visionary and understand their services so well to really do the transformation piece that allows that to become a reality for people on the receiving end of care. If you don't have those people that can bring people along with them because of their clinical expertise, then it has no utility. It becomes it's sort of vacuum, doesn't it, of conversation that doesn't really change the way that we deliver services. So I think the whole series of podcasts has been really refreshing, but equally there's a real affirmation in there that people are energised by it, and can really see that it's going to actually make quite significant change.
And you have an exciting podcast series coming up next for us, Jane. Can you tell us more about it?
Well, I think, probably along the same vein, I think there are hugely talented clinical leaders and nursing leaders out there who will be part of this transformation and delivery of the 10-year plan. And I think sometimes being able to give them a voice and some agency really does promote their value and their worth. And I think if we could actually have some conversations with people who are going to be at the cutting edge of that delivery, I think it would be exciting to do a whole series of podcasts called Cancer Nursing Across Wessex to really bring that to life and really articulate why it matters, to say why it's important. So there's something around really recognising the different roles and the contribution that they make to that. So there will be people working from ward levels for inpatient staff, ambulatory settings. There'll be people working in specialist areas like clinical nurse specialists, advanced clinical practitioners, in places like acute oncology services, SAC delivery services. There'll be people working in radiotherapy, there'll be people working in complex psychosocial care, working out into the community. And then there is the work of our primary care colleagues who do a huge amount. And they're integrated frailty matrons. There are people who are touching people's lives with cancer the whole time. And why they matter as professionals, and why they never cease to keep the patient at the forefront of their thinking. And I think there's something aspirational about hearing about their work, particularly in terms of, the next generation of nurses we want to recruit, and we want people to come into this profession that care and go the extra mile. And I think having the opportunity for them to deliver that in a podcast through a podcast will be really inspirational.
Thank you, Jane. I look forward to hearing more in our second series of podcasts coming up soon. That brings us to the end of our first series of podcasts. And can I just say a big thank you to all those who contributed through these 10 episodes. I hope you found them useful, and thank you again for listening.